Good afternoon, everyone. Allison Scobark here, Consolidated Planning Group. We are excited to be here today with Dr. Tara Coker Devine. This is our first presentation with Dr. Devine that we've done, and I'm really excited for what she has to share with us today. We're talking about how to parent a child with special needs, moving from surviving to thriving. And I know that I talk to a lot of parents, and I myself sometimes there's a lot of challenges that we face as parents when we are parenting our kids with neurodiversity and some of the challenges that we face. So we're going to talk about that today. So from a housekeeping perspective, we're going for an hour today. So if you're planning your day, we will be done within the course of an hour. Today's webinar is in fact a webinar, and we are, you guys are in muted mode, so we can't see you or hear you, but we do know you're there, and we invite you to put your questions in the chat box today, and we're going to get to just as many questions as we can during the time that we have together. And I have a few write-in questions, so if you sent your questions in ahead of time, I do have those, and we are going to be addressing those as well. Consolidated Planning Group, we are a holistic special needs financial planning firm. We're nationally certified as Social Security advisors, members of the Special Needs Planning Academy. We do a lot of educational webinars and a lot of advocacy by way of the webinars, and they all live on the Consolidated Planning Group YouTube channel after the fact. So for everybody that is signed up for today, you are going to get a copy of today's slides, so you don't have to take notes on every single thing that you hear today, because you're going to get a copy of the slides. And it is being recorded, so this will live on the YouTube channel after the fact. Consolidated Planning Group, we help people plan for the future of their loved one. People come to us because they need to know, how much money do we need to fund a special needs trust? How do we preserve eligibility for state and federally funded programs? When should we apply for such programs? We set up lifetime care plans for folks. We do a lot of transition planning. We set up ABLE accounts, and we do a lot of advocacy. And we always like to tell people, when it comes to planning for your loved one with a disability, it's really important that you work with a specialist, whether that's a specialist from a financial planning perspective, or whether that is a legal, someone from your legal team that is specifically nuanced in planning for a person with a disability. Those specialists really matter. Our situation as it comes to planning is specialized, and working with a specialist is super, super important. And so when it comes to planning, some of the things that we think about is, who's going to care for our child when we're gone, or we can no longer provide the caregiving services that we once did? What's next when it comes to transition? And developing a future care plan now is going to answer some of these questions. Thinking about what happens after high school, educational and vocational options. What are some of the living arrangements that might be possible for our loved one with a disability? And some of these facilities have really long waiting lists. So planning early, getting yourself on some of these waiting lists is very, very important. And then when it comes to the future, when we're no longer able to provide the caregiving services that we once did, we always advise to make careful considerations before naming siblings as a future caregiver. We see more of that if a sibling is, 10, 15 years older. But I always say, let's think about this, because just like you, your neurotypical kids, they have hopes and dreams of college or careers or getting married or having a home and things like that. And sometimes being saddled up with responsibilities that are pretty great for kids that are not their own is challenging for them in reaching their goals and where they want to go. So, Dr. Devine, I'm so happy to be here with you. And I just, full disclosure here, I just want to say that Dr. Devine helped me. I think a lot of families are dealing with some severely challenging behaviors that are disruptive to the entire household, and leave stress levels super, super high. And a lot of parents kind of feel in a place of, I just don't know what to do. And what I learned in working with Devine is that when you change the way you look at things, what you look at changes. And we might not be able to change the very situation or everything that is going on with our loved ones, but changing you and you being the best you that you can be, and how you handle and how you work through some of these challenging behaviors makes the difference, and it makes the difference in your overall well-being. And I think it's super, super important. So we're happy to be here with you today, and I just wanted to mention, for those of you, as you go through this presentation and you think, oh my gosh, I think I need Dr. Devine. She has graciously offered a free personalized consultation, a 20-minute consultation for anybody that wants to learn more about her services and how she may be able to help you on your journey with your loved ones. So having said that, welcome. Thank you for being here with us today. And I'm going to turn everything over to you.
Okay, thank you, Allison. It's a pleasure to be here, and I'm honored to have you sort of narrate the bird's eye view of your journey that we went on together, and it makes a difference to me when I hear people speak of that there's some impact to this way of knowing and being that Dr. Neil Sarahan and I developed a little over 10 years ago. You can move to the next slide there, Allison. So the name of our copyright approach is called the Integral Flow Growth Map. Dr. Neil Sarahan and I are both developmental psychologists. He comes to it by way of education field and social policy to impact the needs and programs for neurologically different and special needs children and young adults. And I came to developmental psychology through the clinical therapy world. My first gig in the therapy world was family therapy. So even now, that's a really important part of the work. And as you all know, it is impossible to treat an individual's special needs or neurological differences in a vacuum. So it's a really critical part of our work. Not quite ready to hop there yet, but that's okay. You can leave it there, Allison. It will, sorry, you can either way, sorry. But I wanted to say about this peculiar name of integral flow, how it came to be, because it has something to do with how we experience the individuals that Dr. Sarahan and I had a combined, when we developed it, we had a combined 60 years of doing the developmental work. And 10 of those years we had practiced together. But when we left the institute where we were working, we had therapeutic school, we had, outpatient services, we had, anyway, a range of things we were leading there. And when we left, we sat down and we were going into more sort of private and consulting work. We said to ourselves, well, that was enlivening and rewarding. And now we have time to think a little bit more because we were so busy for those 10 years. And we said, okay, these individuals and families come to us with these lists of names, diagnoses that describe them. But we laid down our traditional, conventional teaching about how we were going to care for them, because we had a very low impact rate in the clinical field of helping with neurological differences in particular. And so we said the onus is on us to be thought contributors about how we could do this better. So we honored our roots, our conventional traditional roots, but we laid them down, and in a coordinated way with the families and individuals, we started to say, what is it that you're really coming to us with? And what is it that we need to be in order to you to experience developmental growth and expansion, and for the families to feel like they're being heard? And so this name, Integral Flow, if you're have been if you're a mathematician or at least recall math concepts from school and or, affiliated with the engineering field, integral flow is a concept that measures maximum capacity of a vessel or a process. And so for us, that really speaks to us because we think about your individual or all the individuals we were working with and having a capacity, not having a glass ceiling after a certain age that says, well, that's it. That was as far as they were going to go. We believe that they have the same developmental capacity to get to who they were supposed to be here in the world. Now, they don't come to it the same way, not the same pace, not in the same rhythm, not in the same rate, but we felt like it was injustice to them to assume that they hit glass ceilings at some point and they just weren't going to go any further. So this is hence the name, integral flow. The onus was on us to help that individual and their family begin to open up to the maximum capacity of that person, regardless of the rate, pace, and rhythm that their development was happening. Okay, Allison, now we can move. So when we sat down after we left and we had time to think and eat lunch for the first time in a lot of years, we said, okay, there were, no matter what set of labels or label they came with, there were these common characteristics. And we spent days and weeks and actually months culling through the sea of faces that we'd had the honor to work with, privilege to work with, and their families. What were those stretches? What were those stumbling blocks? What was it that the family was saying, we're stuck, frozen, or arrested here, right? And so this 8 common characteristics is that list. And let me say, we do not experience or perceive or interact with these characteristics like behaviors. We interact with them, these common characteristics, as if they are your child's or yours way of protecting and defending their unique neurology. It's a way of trying to survive. And so when we were able to turn the dial on perceiving these as behaviors that your individual that you're the care guide for was just using to demonstrate their misery or to make you miserable, right? When we could reset the way we experienced those things when they showed up, we could now get really intentional about how to help them develop and grow by designing intentional conditions for that growth. You see, as you know, at least as well, if not better than I do, neurological differences and or, the range of special needs that we were caring for, if often they do not emulate or respond to social cues like neurotypical individuals might, then they are not necessarily being sort of naturally pulled along on the trajectory of development. Okay, so again, the onus was on us to think through these 8, decide as an individual. Not every individual has all 8 of them. I'd say on average, 4. There are those outliers that have all 8, some that have 2, but probably on average about 4 that really stand out for them. So then it said to us, here's where you need to go to begin to help this individual. So let's run through them quickly, and maybe you can begin to think about your, as you are a care guide or a parent or a professional that's helping individuals, to think through how these drivers might be impacting who you're caring for. So number 1 on the list is awkward social connections. And I would say it is probably the most prominent one when parents or individuals or teachers or whomever come to us for support. And the false assumption I think that happens here is that these individuals either don't care about social connection as much as neurotypical people do, or they're so agitated by it, they want it to go away, or, lots of assumptions about that. But what we know and came to find over our combined 60 years of experience, that many of them, and the literature supports that approximately, there's a few different resources for it, and I'm happy if we speak together, or you want to email me, or I can get more specific for you. But that individuals with neuro diverse makeups, wiring, biochemistry, between the ages of 0 and 6, they make 80% of the same attempts that neurotypical kids do at social connection, but they meet with almost 100% failure in those. And so they retreat to their I world, capital I. The notion of we becomes not safe, or too wounding. And so here we are. Next thing you're starting maybe to see is they're depressed over not belonging, so they avoid even trying to connect, or even up to agitated depression, which can look like rage over being excluded from things. So the next is unexpressed strengths. I don't know if I've ever met a neurologically different or special needs child that didn't have a superpower. And the struggle with that is that how do they get that into the world, right? And so when they can't, I mean, they experience their strength as kind of enlivening or uplifting in some way. But when they can't figure out how to get that into like a reciprocated interest with someone else, or in a way it serves, then they feel ostracized. It can lead to anxiety, alienation, and just basically low self-perception and expectations. So a third, and it's also quite common, is chaotic sensory integration. You may experience this as light sensitivities. Hearing is a big one. Their radars are tuned up sometimes twice as high as ours. Crowds, their sense of space. These are some taste, satiability, responsive sense of foods in their mouth, get a lot of response, sometimes panic, agitation from any of these sensitivities. And I have known some of the individuals to have all of those. So you get the reaction of overwhelm, panic, agitation, stomach, physical stress, but actually it starts with their neurology, right? Aloneness. I think this draws an arrow back to the awkward social connections, where there's, sort of give up, and they become isolated. So too much aloneness, too much inward dependence, and so disconnected, retreated, and they often are, reacted to as they're just kind of aloof and don't care about people. And it may come to be sort of like that for them, but it is not the roots of it. So anyway, it's these first four. Maybe you can think about those, and are these sort of like root causes of some behaviors and patterns that my individual has developed over the years. You can move to the next slide, Allison. Thank you.
Are you seeing it on your end?
The change or the question?
Yeah, I've got difficulty learning from others on the
Okay,
screen.
yeah, okay,
Okay.
yeah. Now it just popped in. Sorry, yeah. So, what is this one about? Well, since we had a therapeutic school where Dr. Sarah and I worked before. He's now retired, by the way, but we still work closely together on lots of things. But when we were there, there was a therapeutic school, and we saw this pretty and like the individual would have, again, maybe even like a superpower in a subject. I often think about this one individual that could look on the board of his math teacher, and within 30 30 to 60 seconds, solve a calculus problem that other people spend a minimum 4 to 5 minutes trying to write out and think about. But when the instructor would say, okay, well, let me help you with how to get through those, because, and this young man was college bound, and so he's going to have to demonstrate his work, right? He was not going to be able to just call out the answers on a test. So the ability to slow down and pace with another person, that's an executive functioning skill, right? It's part of the monitoring executive function skill, ability to notice how your behavior is affecting other people, and ability to pace with another person. And so oftentimes it isn't that they can't learn, but you often, they'll present irritable, anxious. I mean, had a couple kids that would just bounce right out of the class. They weren't even asked to leave. They just couldn't. It made them so anxious to have to slow down and coordinate with both the instructor and the other learners that they just couldn't be there. So they would spend some time in my office getting back to self-regulation. So the next one is a cognition, only loosely connected to meaningful connection or contribution. Again, maybe your learner or individual has superpowers. There are topics, perseverative topics that you're like, okay, that's, they're 10 and they're speaking about these topics at, at a university level. Or, I had a young man, he just was like a walking encyclopedia on 2 or 3 topics, but he couldn't, and the number of these individuals could not get that back to being used in a way that they were contributing and reciprocating. And so when other people don't hang in with their perseverative sort of monologue way of presenting what they know, then people flat out walk away from them, or run when they see them coming, or so then they feel disrespected, like other people are disinterested, and they again, it's back to the isolation and feeling siloed. So you can see a lot of these things point back to that sort of isolation piece again. Cognitive rigidity, also very common, very black and white thinking, just difficulty, I mean, very literal, right? And so when even people are even aligned with them in a way of talking and thinking, but the other individual might throw in, a euphemism or a bit of humor or something, then this cognitive rigidity or black and white thinking, it's just sets up for conflict, or just disconnection, both from when you're trying to parent them. They cannot see the gray of why you need to change a schedule, or what that might be. So that can be sort of arresting in a household, I know. And then this last one, number 8, if you'd known Dr. Sarahan and I for the last 9.5 years, you'd know that we used to talk about this being 7 common characteristics, because we were always debating whether this number 8, earned a place on the list. And we recently, over the last 2 years, have been writing a book about our approach. It should come out in 2025, maybe mid-year. So also maybe I can, let Allison know when that happens and communicate that with you. But this last one is difficulty sharing perspective. Maybe you've heard about mind blindness before. Inability to think about you thinking how you think, or you thinking differently than them on something that they're very quite convinced of or have experienced. So, and it is not just like they have a hard time doing it. It's just like it's emotionally dysregulating, that you are not thinking like them. Like, so obviously this is a terrible interruption to perspective sharing, which is how, pretty important to relationship. Yeah, right, exactly. Theory of mind. So I see here, Allison, a couple of questions. Would you like for me to pause
Yes,
and
let's
try to
let's
address
go
them?
through just a couple of them.
Mhm.
One said how to find a psychiatrist in Texas with experience helping an adult child on psych meds to safely taper off, like titrate down when
Yeah,
ready. Do you
yeah.
have suggestions for finding a good psychiatrist?
Well, I do have a short list of names. I do understand that it's difficult to find that. And it's a short list of names. And if so, if you will email me and you'll see that, I'll be happy to, or even if you want to, a consultation about it, I'm happy to point you in that direction. I just want to validate that it's difficult and that there is this notion that once you have been labeled, then that label is attached to a medication that you must take the rest of your life. And so you're coming against an old school and way of teaching in psychiatry. I'm not against psychiatry. I'm not anti-meds. I'm just sort of zooming the lens out about why this is hard to find. And so it's a more innovative kind of, newer school psychiatry that's looking at this and why it's important. And of course, I usually don't recommend it without there being some therapy involved, a therapy or a therapist that is, that your individual, can find some common ground with. I know not every therapist is a perfect match to other people, but I have a team of individuals that work with me, three other clinicians, and they are um, in our approach. They're well versed, but also they have unique. Have one that works with the littles, we call them, and then one that's more adolescent, and then one is sort of like transition age post high school. So anyway, there there are some options in our agency to support that, and we work closely in collaboration with the psychiatrist who might be managing that. So
And and
happy.
and likewise, whether you're tapering off or starting meds, um it is a lot of push and pull. And while some meds may be the gold standard, it may not be the gold standard for your loved one. And it's kind of a trial and error thing, and it can be bumpy along the way. And somebody put this in the chat box. I know that we've used gene site testing before. Your psychiatrist that you work with has access to a test, and it's an oral swab. I feel like it should be the law in the United States. But most insurance they'll cover it, and if they don't, it's about 300 or 350, and they only have to do it one time. It's an oral swab, and every kind of mental health medicine, whether it's ADHD, mood stabilizers, antipsychotics, anxiety, depression, all those meds. It's basically looking at the metabolic makeup of that individual and testing and kind of a red light, yellow light, green light, what meds may be more effective or not effective at
Right.
all. And
Yeah.
so I am a huge fan. I think it could minimize some of the trial and error by getting that done. So I always just like to mention that. So we have another question. It says, my 19-year-old son has Down syndrome and is nonverbal, but can say the names of his siblings and mom and dad. What do you know about dating or relationships for a person like my son? I believe a relationship could help his communication.
Yeah, absolutely. We were enormous proponents of no matter the neurological difference or the special needs in any way that relationships were available, and even the notion of dating. I get that there are different maybe uh ways to initiate that, and but we actually I when I first went to work at that institute that Dr. Sirhan and I were at, what I noticed was missing from the curriculum was healthy adolescent sexuality. Why are we sweeping that under the carpet? Let me assure you, if every other category in your child's life or grandchild's life, whomever, is developmentally delayed, that's the one that is not. All right. So you will see, and I can see there's also a question about what do the circles represent, and I'm going to show you the map, and I'm going to dive into that. But one of the uh, territories on the map, or the circle, if you will, is called belonging. And we get very specific in healthy adolescent sexuality, and we also had healthy sexuality for the young adults and older adults we were working with. That having a relationship is not like acquiring real estate. It requires some skill sets. And so just like all of the other um, developmental constructs that are either stumbling blocks or they're frozen or stuck or arrested, we would go intentionally into those constructs and begin to help the individual practice at those and try to facilitate. You'll see also when I describe our services that we emphasize group work. And we call them practice zones, because just working individually, it is helpful, but the practice is in relationship to other people. And so whether you're trying to relate to someone you want to date, or you're trying to there are lots of common skills between friendship and dating, right? And so we would tend to work on those at the same time. That's a great question. I'm glad you can have that, intention for your son. Let's see, have I covered the baseline? Yeah, there we go. Okay, so here's the map. And we thought about development as a journey. And this map is actually a human development map, not just a map for neurological differences or special needs. We all can find ourselves on this map, and I'm going to get even more specific after this slide about that. But I want to talk to you about why the quadrants are the quadrants. If you look to the left side, the left hemisphere of the map, you'll see at the center the capital word I. So these two quadrants of competence and independence, I become a credible contributor of my strengths and skills, or I become the manager of my abilities and actions. This is your I world. This starts with your driver to adapt, okay? So if your individual that you're the care guide for has some points of stumbling block, incompetence or independence, or they're frozen or stuck in one of the constructs, the onus was on us to go to where that stuck spot is and get intentional about designing individualized practices for that client, and not just doing that in individual work, but doing that in a group, so they can even begin to start to experience themselves as stepping toward more and more competence and independence, while also amongst other people. And on the right hemisphere, the we of our lives, which represents the driver to attach, there is social care and belonging. Social care, we offer gifts and care for our world. So this is an effort that we saw developmentally was paralyzing for the individuals we were working with, that they had begun to see themselves as broken, to see themselves as always the person that was going to need care, and they had nothing to offer. And so other people, or even sometimes their care guides, begin to sort of like get drowning in that same notion. And so we also wanted to get intentional about helping them discover their ways that they can contribute and care for other people. So we'll talk about in a minute the specific constructs there. And then lastly, the fourth quadrant, belonging. We live in authentic membership within our communities. And we see belonging, despite the high prevalence of social awkwardness, despite our culture often thinking that these individuals can't connect, don't care about connecting, don't want to connect. We are the antithesis people of that. And so we believe that they can be, and we saw it over and over and over again, the expansion and the growth and ironically, in the social care quadrant, how as they begin to see themselves as contributors, it impacted every other quadrant. So if I pop back down to belonging, we see that as belonging for humans as much as primitive, I might say, as, hunger. You know, it's like one's for food, one's for connection, but we see that even in, we believe in neurological differences and special needs as really fundamental and possible for them. Yeah.
Tara, I mean, I want to know how do you close the gap on that? Because you hit the nail right on the head. A lot of our kids feel like they don't belong. They feel less than. They feel like they've always been in trouble. Everything that they do is wrong. Some of the things. So they're always in trouble at home. They don't get their homework done. The kids at school tell them all about themselves. And so it comes down to they have a terrible, terrible self-worth and self-esteem. And how do we get them back to center on that? Because it's
Yeah.
been years of beating down, and I'm not saying the parents are beating them down.
Yeah.
Life
Yeah.
is beating has been beating them down. So
Absolutely.
how do we get them to center so they can move forward from that?
Yeah, yeah, that's a great question. And it is really central to my whole career when I was doing my doctoral work in like a 5-year process. My topic of research and writing and designing application was resilience, fostering resilience despite cumulative adversity. And when I got hired, I lived, out of state. I'm from Texas originally. I lived out of state in Maine for 20 years. When I came home about 15 years ago, I got an offer from this institute that specialized in neurological differences and other special needs. And so I went to the interview, but I said to them, I have to be honest with you. I have not been a specialist in neurological differences. And they said, well, we know that. We're specialized at that. It wasn't that I hadn't worked with it. Post-trauma work had been my first 20 years of my practice and in fostering resilience despite trauma. So they said to us, that's why you're invited here, because we think the world is traumatic for these individuals that we're caring for. And we need someone to think about this in terms of resilience. How do we begin to rebuild a resilient toolkit that keeps them from retreating, from isolation, from determining that they quote unquote can't? So anyway, that's my early answer, Allison. But if you pop to the next slide, I'll get more detailed about that for you. And we'll start with belonging. So you'll see the common thing in each of these quadrants is we narrowed it to 5 constructs, 5 developmental constructs. Sometimes we call them territories in the region on the map. Sometimes we call them developmental strands. And each of them has a specific operational definition to them, but you can look at them and read them and get a general idea. And I promise you, you'll be very close to what the operational definition is. And so just like every other construct on this map, we find a strength and a stretch in every quadrant. We not only ask the individual their experience, we ask the care guide, the parent care guides, sometimes it's grandparents, sometimes it's a teacher. I've even recently asked a martial arts teacher where this young woman had flourished for 6 years. I'm like, I want to know what this instructor thinks here, right? So look, finding where that stretch and where that strength, and I know there can be more than one stretch in a quadrant, but we try not to overwhelm in our initial launch on work. We'll pick one for one stretch in each quadrant. And so that's where we begin to say we have to go on a journey. We have to get so intentional and not make any assumptions about what you need. How now to give you an image, use imagery here. We think about these quadrants almost like they are a vessel, say like a pitcher that might hold liquid, if you will. And what we are doing and what we invite parents and we coordinate and collaborate with them on is to pour in practices, intentional conditions. And there's lots of repetition involved here. And we accepted that patience at this was going to be really important because we need to see. And I remember seeing sometimes maybe an individual not making an enormous amount of traction after a couple of practices, but I could see the smoke coming out of their ears. I could see how hard they were trying. And so we would stay in there and keep trying just as hard. And it's still the work that we do. And so, and sometimes it is the strength that the individual or the family or the teacher, whomever teaches about in that quadrant, that we begin to pull on. If we can pull in this strength, the superpower that you have to help, and when we're designing the practices, designing the intentional conditions for expansion and growth, if we can pull in that strength, we go a lot further. And so once again, as often as possible, whether it's in groups that we're hosting at our center or things that your learner individual is involved in, either at home or in community or in extracurricular, we also try to collaborate and coordinate on getting intentional in those places about developing these things. So is that helpful at all, Allison, to think about um, in answering your question?
Yes, I think that's really good.
Mhm.
Thank you for
Yeah,
sharing that.
you bet.
One person said, do you go with them to work when transitioning? Any out of office work that you do?
Yeah, we can do that. We have a program that we worked at that does that really intricately and has a set of coaches. We'll go to a workplace at times and we definitely go into schools.
Very good.
We even go into your home because sometimes it's still things like, why do you all think just saying those words is helping me do that in my home? So we actually can go into the home as well. It's not a mandate that we do that. We're not going to force ourselves in there, but if you believe it can be helpful, then we certainly try to do it at least a few times, right?
And
Uh,
sometimes it's good to just see what happens because sometimes what happens in the home and what happens at the school are two different
yeah,
things,
right, right.
and
Yeah, yeah,
either it's terrible at school and fine at home or vice versa. And
yeah,
so kind of getting to the root of that.
yeah.
And this slide kind of lends itself to this. Well, it's more of, kind of what I was talking about at the beginning when you change the way you look at things, what you
Uh-huh.
look at
Uh-huh.
changes. How do parents cope with PTSD when the child has regression?
Oh yeah, well, I think one start, of course, trauma work, whether it's parents or the individual, has been part of my early career specialization. But um, I think accepting that regression on occasion is going to be part of it, um, and that the journey, like if you see these developmental strands or territories sort of go, obviously a trajectory going outward in development, but that doesn't mean that the line is straight. The line is 99% of the time jagged, right? With sometimes even some backward, moves some backward XY coordinates. Now, what we want to do is get curious about the regression, okay? And I know it's weary making. We 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 100% see that and um, try to live into that with the parents or the care guides, if you will. And so, first of all, we want to get really curious about what that regression is driven by. First of all, you want to rule out anything, biophysical, right? Um, so often, I'll tell you what I see. It's not the only reason for regression, but in trying to sort of say at the PTSD that comes from regression, to say, what is everything we did like for naught? Is the hundreds of thousands of dollars in many cases we've invested, it's just lost? Is it like where is the, where do we get to any kind of belief that what we're doing is getting some traction? And so I think we start there with the PTSD sense of getting to the exploration. But what I should finish saying is sometimes you will see some traction, forward momentum. And remember that regardless of where your child is in development XY coordinate, um, around them, what they're surrounded with, and in a culture that says, you look this old, you're chronologically this age. So they are subjected oftentimes to these expanding swirls, layers of things going on around them that they need to integrate into their neurology, which is often, I mean, you and I, or any of us, like consider ourselves, mostly neurotypical, right? That we uh, changes come, life gets heavier. We sometimes we grasp onto some kind of resilient tool to keep going forward and to operate, and we go get resources. Sometimes your child is experiencing these expanding layers of the world. It is so overwhelming that you'll get a flat line, or sometimes regression gets to be too much. But there could be a number of reasons, so that we go on that exploration journey with you.
Dr. Devine, I mean, to that point, one of the things for me as a parent, again, I'm just being humble here, is that first realizing that because our kids oftentimes they look the part, but they're not there yet. Our kids are
Yeah,
2, 4, 5 years behind
right.
from a
Yeah,
maturity level, so they may look like
yeah.
the norm in body, but they're not
Mhm,
there yet. So
mhm.
that's one thing that I really had to look at, and I had to tell myself, we have to meet them where they are. It doesn't matter about Facebook and everybody's great kids and what everybody's great kids are doing on Facebook.
Yeah.
Meeting our kids where they are. And if they're 12 and they're functioning as a 9-year-old, we need to meet them as a 9-year-old,
Mhm.
because part of the failure that they feel is they've got these 12-year-old expectations, but they're functioning with a 9-year-old brain, and they aren't capable of being there. And then the other thing that I had to talk to myself about is that a neurotypical brain is not even fully formed till 26. And I have to tell you, when my kids were younger, it felt like eons away. We're getting closer. We're not there yet. It felt
Yeah,
discouraging as a parent of, oh my gosh, really?
yeah,
And then wait, we're 2 to 4 years behind that. But each year, I just want to say some encouragement that each year we haven't arrived, okay? But we are far greater and far better than where we were before. But part of that had to do with me and realizing I needed to meet the child where the child was, regardless if they were behind. It didn't
yeah.
matter. And
Right,
that
right.
and meeting them where they were was how we started moving forward.
Yeah, yeah. Thanks, Allison. And I see also there was just like a another addition to the, like, do we do any out of office work? Which we do some, and then we're connected to other people who do like, it's mostly what they do. So if you can benefit from that, then we, collaborate with them for your care. Um, but this additional question about any behavior people, we're not behavioralists. We're right now I don't have any ABA people on our team. We do see it as one tool in the box, but it's not our primary way of trying to, foster development and expansion. We, could name a list of times where it's an important tool to use. But we have a list of people when that seems to be the piece that needs to happen. Then I think I saw a question. I don't know if it's like right before Alice and I hopped on, or in the early string. I apologize for missing it. That had some like self-mutilative behaviors um, going on, and I think that ABA can be quite helpful, particularly in that circumstance. So um, I think I've answered most of those there. So let me hop to this next slide. So once you have developed, we have assessed for, it's part of our whole assessment developmental assessment that we do. We take the map, we give it to each individual involved, and we say where's the strength, where's the primary strength, and where's the primary stretch in each quadrant. Well, now what we must do is find the developmental stage in that strand, that developmental construct that your child is operating in. All right. And so each of these words you can see on the we side of the map, in social care and belonging, the stages are and the closer, of course, to the center is the more primitive the development. And so, referencing, like even, can you even notice around you? Can you begin to reference what other? And so we help with referencing. We get very intentional about that. Moving into maybe the next stage of interact, and then contribute, and then synchronize. And you, as I said earlier, we all live on this map. We can all locate ourselves on here. And I can't say to you, I'm like in every developmental construct that I'm optimally integrated or optimally synchronized, right? So it's an ongoing development, right? For all of us. So in the way, there's a whole nother set of slides. There are 35 slides. I've tried not to overwhelm you today. Dr. Sarahan and I, by history, teach 4 and 8 hour conferences on this top, so I'm trying to get it all into an hour for you. But finding that developmental place, we have defined in each stage category, what are the 10 or 12 things a person can usually demonstrate if they have mastered that stage. And that comes from our, now collective almost 70 years of experience as developmental psychologists, of knowing what those things usually are being demonstrated. So we help you review that and measure that as we're looking to find the developmental stage for your individual. But it is another one of the green arrows that tells us where to put ourselves. What XY coordinate do we need to go to meet your individual? Because can you imagine, like as Allison was saying, they look a certain age, they look like maybe they could or should be more functional in developmentally than they are. And so someone standing out there on the contribute line part of the map, calling them over. Why don't you get over here? Well, you're not going to be able to travel there if you haven't even started on the stepping stones for the most primitive parts of development. So, and we have no judgment. We don't care what their age is. And Anna should throw in here that quite often, including myself, my developmental abilities around this map are jagged. I'm not at the same maybe stage, or haven't always been the same stage in every construct, right? We can be, mid-development in one and, be fully integrated in another. So that's why it's so important it's a zero judgment zone. And sometimes it's hard for them because they believe if they have to slow down and accept and identify where they are, then it means they're that arrested in everything else. So we have to spend a goodly amount of time teaching them and assuring them about what this journey means and what it's about and where we're going, that kind of thing. So yeah, so those are the big macro pieces of our approach. Allison, if you want to pop to the next slide there. So this is the name of you saw the name, the mothership is Integral Flow of our company, and because that's what our copyrighted materials, but our practicing place is the Neurodevelopment Center of Greater Houston. And right now it's 4 of us. It may be growing. So we are, and you can pop to the next slide there, Allison. These are the things that we do there. Developmental assessments. We take your individual and we look at each one of those constructs you saw on the map, and we find them there. We also spend lots of time looking for their superpowers and the stages that they're in. Groups, and we have them for the different developmental stages, right? And we hover between 4 and 6, keep it pretty tight. Of course, there's individual therapy and coaching, family therapy, parent coaching. We do, as I said, go in the homes, and the educational setting assessments and coordination. That doesn't mean we're going and do an educational assessment. It means we will go and coordinate with the school or any academic institution that your child's part of, and get coordinated with them and collaborative. We don't like to go in and make them feel like we're hyper criticizing or judging them, but really try to form a relationship that says, you all are great at this thing, we know a little bit about that thing, let's see if we can we can get this student to optimal. And I have one individual on the team. We're all trained in coaching learning differences, but one individual that, it's like 9 certifications in it. So she is our superpower at that. And we do that even for like one of the individuals, the one that's post high school. She works with college students or kids that have interest or aptitude to go to college despite neurological differences or special needs. And so she will, if learning, if executive functioning or learning differences, then we do coaching on that as
Do
well.
you
So
work with older adults? I know you work with parents and stuff like that.
yeah,
Do you
yeah,
also work with older adults
yeah, we do.
with neurodiversity as well?
Absolutely. I have a woman who's getting ready to retire that's neurologically different. She didn't discover her neurological differences until her late 50s. She'd just been sort of bouncing around, being sort of bruised up and bunged up by the world. She's very bright, like many of your, a number of your children have some cognitive superpowers. But so she'd been able to get through colleges and that kind of thing. But the social and relational part had just been gruesome. So that's an extreme, right? Someone who's getting actually ready to retire, and then we have quite a number who are in their late 20s and 30s. Who are trying to get coordinated in their employment, employability, and that kind of thing. So
We're seeing a lot of late diagnoses of autism over the last few years. We've had lots of families that have come to us and their kids were in their 20s and 30s
yeah,
being diagnosed for the first time on
yeah,
the
mhm,
spectrum. I mean, it is a spectrum, but
yeah.
whereas it may have been labeled as, oppositional defiance
Oh
or
yeah,
any
right.
number of the alphabet soup of
Yeah.
diagnoses that can be thrown around. So we've been seeing a lot of that over the last few years.
Absolutely, which is another driver of why we started to talk in terms of common characteristics, right? What are the drivers here rather than, what's the label? So then maybe earlier on you can start, getting, working on those things and trying to get intentional about the expansion. So again, you can contact me. That's a QR code, obviously. If you want to put my contact, it's a Blink digital card. You can put me in your contacts. It also, one of the things I didn't list on the slide was the website. We have a website that comes up with the QR code. But if you're not using the QR code or have any difficulty with it, the website is Neurodevelopment Center, G like giraffe, H like Harry.com.
And
So
someone said, and you may have some of this stuff on your website, and is there any recommended publications where we can read more about your model?
well, the website does, describe it more, but right now, as I mentioned, we our book is supposed to come out this year about at the earliest early summer, but more likely midsummer. So maybe you're asking possibly about kind of like what are the theoretical foundations of the model, and I could definitely try to answer some of that through an email or because of time's sake. No, I know we just have a couple of minutes, but but there are of course, you again, you want to recognize who you're working with is with two developmental psychologists. So we tend to think in terms of development and parts to the whole rather than just sort of isolated what's one clinical problem. Or, I mean, clinical work is, I'm licensed clinically, but clinical work's really important. But I'm saying when it comes to these kinds of um, needs, it requires thinking of all the parts to the whole. And so I'd be happy to, in an email or a consult, speak with you all about that.
Everybody's going to get a copy of today's slides, and when we send that email out, we'll also put a link to her website as well, so you guys
Mm.
can check that out. And just personally, I just want to encourage you guys to reach out to her. I'm a strong person. And I can just truly say it really changed our life. Kind of the differences is like again, there's a lot of things you can't change, but you can change you and how you work through this. Our lives are tough. Sometimes there might even be construed as bad. uh, but
Yeah.
there are ways forward and paths forward, and there is help out there. and even for the smartest folks out there. And, I call our parents on the constant pursuit, the relentless pursuit of information and
Absolutely.
how
I
to,
have learned so much from the parent. That was part of our laying down the ropes of our old classical training and say, let's go on a collaborative journey with the people who are living with it 24/7, right?
yes,
That
yes.
really quite I will tell you about the different theories that inform, but I'll tell you some of our greatest informants were the parents and the individuals.
It is for sure.
Yeah.
Well, thank you, Tara. Guys, we are going to have another webinar with her. We'll probably have one this summer when her book comes out. But the today's webinar was more on kind of the parenting thing and some of the challenges that we're seeing with some of our kids with neurodiversity. But next time we're going to talk more about you and being the best you and things that you can do and work through to be where you need to be for your kid, with neurodiversity. So we're going to have another webinar with Dr. Devine on that. So thank you everyone for being here today. You'll get again a copy of these slides and a link of where you guys can connect with her. We always offer free personalized consultations at CPG as well. So you'll have a link, a QR code for that as well. So watch your email. You guys are going to get a link to the recording and a copy of today's slides. And again, we will put a link to her website as well. So thanks everyone for your questions today. Your questions were great and it helps others as
You're
well. And thank you, Dr. Devine, for being here with us today.
welcome. Thank you
It's
for the
certainly been
privilege
a
of being
pleasure.
here. Yeah, it's a privilege. Thank you.
All right. Thanks so much. And we'll look forward to connecting with you again soon.
No,
Bye now.
here, bye-bye.